Hello, everybody. Today we are going to compare Myxedema Coma versus thyroid storm. Now, I want you all to think about this like NCLEX thinks about it. These are both thyroid emergencies, but they move in opposite directions. So I'm the nursing student Avenger. I'm going to be your NCLEX tutor. Subscribe to this channel so you get daily update on NCLEX tutor topics. Okay, so let's start. So myxedema coma. Myxedema coma is a form of severe hypothyroidism. So the body is slowing down, whereas thyroid storm is a severe form of hyperthyroidism. So in this particular scenario, the body is speeding up. Here is the easiest way to remember the two conditions. Think of myxedema coma as low and slow, whereas thyroid storm is high and fast. Now, let's start with myxedema coma. So when you hear myxedema coma, think about this. Think about cold. Think about slow. Think about sleepy. And then there is low levels, right? And so the patient may have low temperature, so hypothermia there. The patient can have bradycardia. The patient can have hypotension, low respiratory rate, and can have decreased level of consciousness. In some cases, they can also, or you can also see hypoglycemia as well as hypernatremia. So on NCLEX, if the patient looks cold, bradycardic, hypotensive, and has mentally declined based on your assessment, you should be thinking about myxedema coma. Now, what is the priority? So because NCLEX is a safety exam, most of the questions you're going to see would be what are the priority, meaning to say safety measure. So for myxedema coma, the priority is going to be airway and breathing. Now, why is that? Because this patient is slowing down. We talked about that, right? The respiratory rate can go very, very low, and then the patient can have worsening decreased level of consciousness. So you combine that together, that's going to be the priority, right? So before you focus on giving thyroid hormone, you need to protect the airway and breathing first. Now, after that, warm the patient is the next step. But this is the key here. Do not rapidly rewarm the patient because it can worsen hypotension and can contribute to shock. So we do want to slow the warming process, not abruptly because of that scenario. So next to warming slowly because the patient is hypothermic, the next thing you would anticipate is the administration of IV levothyroxine. Remember, IV levothyroxine is a thyroid hormone, and because the patient has decreased level of thyroid hormone, administration of a levothyroxine is important. Then comes the monitoring of the ECG, and we need to check the blood sugar and the sodium level because remember earlier we talked about the fact that it can cause hypoglycemia and hyponatremia respectively. More than likely, this patient is going to be in ICU for continuous critical monitoring. Now, the other thing I also want to emphasize when it comes to the administration of levothyroxine. So we give levothyroxine on patient with myxedema coma. One of the necessary nursing interventions that you need to know is to monitor too much of this medication. So we don't want to go to the thyroid storm component of it. So one of the things that you need to monitor or you need to look for in the choices is any signs of hyperthyroidism because we're giving too much levothyroxine. Okay, y'all, let's go to thyroid storm. So when we talk about thyroid storm, as I've said earlier, this is a severe form of hyperthyroidism. So instead of low and slow, think about this. The patient is gonna be hot. The patient is gonna be fast, so you're gonna have fast heart rate. The patient is gonna be restless because of too much level of thyroid hormone. And of course, think about everything elevated, right? So this patient may have a very high fever, so hyperthermia. The patient is going to have tachycardia, hypertension only in the early stage because they tend to compensate as the clinical phase goes along. The patient is going to have agitation, confusion, and sometimes diarrhea. They can also develop dysrhythmia, y'all, because the heart rate is too fast, and they can possibly end up with heart failure. So the other thing I want to emphasize when I talked about elevated temperature, this temperature, y'all, is very, very high. This is very, very high. Not the 100, 100.9 or 101. This is going to be around 102, 102.5 degrees Fahrenheit. So it's really, really high. So guess what? Our priority is quite different from myxedema coma. So, okay, so if NCLEX, and you see this in your exam, if the patient has really high fever, tachycardia, restlessness, so high fever, tachycardia, and then you're going to have restlessness, uh, this is when you think about thyroid storm. Now, what do we do first? So the first thing for thyroid storm, y'all, is different from myxedema coma. Look at this. The first priority is cooling measures. Why? Because the patient has a very dangerously high temperature. That's why that's the priority. The second priority is to slow down the tachycardia because, again, we're concerned about that causing possible dysrhythmia and heart failure. So we can give medicines such as beta blocker. The preferred beta blocker for thyroid storm is propranolol. So just to go back to our beta blocker content, propranolol is a non-selective beta blocker. So it blocks both beta 1 and beta 2 receptor. Just to go back to that pharmacology. So after we treat the tachycardia, the next thing is we need to give anti-thyroid medications. Example of the anti-thyroid medications are PTU, so that's propyl urothyroxine, right? And the next one is metamizole. Now, the best warning that I can give you when it comes to NCLEX, because they love this, is this one. Give PTU and metimazole before the iodine solution. Okay, so why is that? Because iodine, or however you want to call it, blocks the release of thyroid hormone. But you want to block new hormone production first. So the usual NCLEX sequence is Anti-thyroid hormone first, followed by iodine or iodine. Okay, so just in case NCLEX is gonna ask what would be this iodine solution, so remember this Lugol solution, okay? So remember that. Now, the next priority is you may also see the administration of glucocorticosteroid and continue cardiac monitoring, of course, because remember we talk about a fast heart rate and potentially having a risk for dysrhythmia. So let's bring it down together. So let's start with Myxedema Coma over here, right? Let's start with that. So think low and slow, okay? Think of cold temperature, think of bradycardia, think of hypotension, very slow respiration, and decreased level of consciousness. And what is the priority? Always airway and breathing first, and then warming the patient slowly, right? Because warming it too fast is going to worsen hypotension and then possibly potentiate the patient to have shock. Then administration of levothyroxine, and then of course cardiac monitoring. Okay, now let's go to thyroid storm, right? So think about thyroid storm as high and fast, right? So high and fast, think of very, very high fever, very fast heart rate. The patient is hypertensive. The patient is agitated or restless, have potentially having diarrhea, right? What is the main priority? Because the patient has a very dangerously high fever, cooling measures is the number one priority, followed by the administration of beta blocker, and then the administration of anti-thyroid hormone. However, iodine is given after anti-thyroid hormone are given, right? Because that's what NCLEX is trying to trick you. The administration of corticosteroids, and of course, ECG monitoring. Now, quick NCLEX check just to go back again. As a tutor, I like to repeat things so that it sticks. So, cold, slow heart rate, low blood pressure, and decreased level of consciousness. What do we say? Think about myxedema coma, right? High fever, tachycardia, agitation, and diarrhea. What do we say? That is thyroid storm. So I don't want you to memorize these two separate diseases. Compare them, right? One is too low and too slow. The other is too high and too fast. But both are emergencies. Start with ABC, temperature, cardiac monitoring, and safety. So, like I said, if you like contents like this, I'm going to be your tutor here on YouTube. And if you're able to subscribe to my channel, thank you so much. I'm going to do another topic next video.